Okay, so for Chapter 5, we're going to go through the electronic health records. So let's just do an overview of different computer terms, which hopefully a lot of you already know. We're going to start off with the hardware, which includes the physical equipment, the machinery that is used by the system, and then you have the central processing unit, which controls the process of information throughout the system, and this will be the primary storage unit. And then your input devices, where the information is entered into the computer system. And different examples that I have down could be the keyboard, the mouse, any scanners, microphones, or cameras. Well, then of course your output, how do we get the information out? Well, this would be your printers, computer screens, anything like that. That gives you the display. We also have storage devices. This is anything that holds data during processing or for later retrieval and use. This could be any chips, DVDs, hard drives. You also have networking equipment. These are connected to the network. They run your applications, wires, modems, routers, cables that are used to connect the system. Software. Okay, so operating software. This consists of a set of computer programs, which keep in mind we're going to be using, or we have been using, EHRGO. So this would be a software type package. Application is a computer program that allows the user to perform a particular task or function. So this could be billing coding software, which again, later down the road we'd use a 3M system. Document imaging. So the whole evolution, I'm not going to get too much into this. So we go all the way back to 1970, 1980, which is actually where your computerized medical records start. It really didn't start coming into where people used it a lot until 1990. This is where we got the computer-based patient record. The Institute of Medicine at this point released a CBPR in 1991, which developed the longitudinal patient record. And what is that? It contains records from different episodes of care and providers and facilities that are all linked to form a view over time of a patient's health encounters. So again, this would be somebody going to a bigger clinic, possibly seen in dermatology, possibly seen in OBGYN, possibly seen in urology, and they bring everything together into the one patient's record. It also facilitates clinical decision support. It analysis of diagnosis, treatments, and it gives you medical alerts. Is the patient allergic to anything? So again, evolution. Again, we have dictation, and from the dictation, a doctor dictates, and from that, the transcriptionist types it out. And now anymore, they are using Dragon voice recognition. So all of this started getting merging. So again, we just keep moving and moving forward. We talked about optical disc imaging in the last PowerPoint. You can review that. Scanning of documents, this is a big one, and you will see this a lot when you go out into medical record departments. They're getting to the point where, I would say 5-10 years there won't be much scanning anymore because hopefully everything's electronic. But how do we prep? You want to remove all the staples, paper clips, or fasteners from the documents. And then at that point you want to ensure that the patient's name, medical record number is on each page. If the document is two-sided, the patient's name and medical record number must be on both sides. And then you want to repair any pages that have tears, which they will cause a jam. Scanning of document, you have each page's index. That means you're looking at each unique identification number of each patient. That way it goes into the correct chart. Barcodes are machine-generated identification codes that can be used on paper documents. So when the document is scanned, an input device known as a barcode reader, and everybody knows what that is because anytime you scan groceries or any items, if you go to Target, Walmart, or the grocery store, it comes out with a specific, again, amount. Where this, when you read the barcode, it comes out to a specific patient. Advantages of a manual record. So this is our good old paper record. Of course, there's a low startup cost. It's easy to train the staff. It requires less technical trained staff, and it's available right away because there's no downtime. What are the disadvantages? Handwritten information can be very difficult to read. Sometimes if you're reading it too fast, it's difficult to abstract the information. Undocumented services are not easily discovered until discharge analysis occurs. So what are the advantages, of automated records? These improve access to patient information. You just pull up their number and there you have it on the computer. Multiple users can access that information at the same time and remotely. So keep in mind that with this, if one doctor is looking at it in, let's say they come into acute care, and you want the respiratory therapist or the pulmonologist to look at it because they're having, let's just say respiratory issues, they can do it at the same time. Advantages also can be customized however you want it done. The updates occur easily. You have customized retrieval of information. Security is enhanced. And again, reduction in administrative cost. What are the disadvantages? It costs a lot. It is going to cost your company, facility more money. Selection development is time consuming. You want to get that right product for your company, for your hospital. So again, you're going to have somebody compare the difference between Cerner, Epic. Epic a lot of times more for hospital. Cerner sometimes is more physician side. Staff training. You're going to have to get your staff all trained on this, and that can be costly. Technical staff is needed, so you need to pull somebody in with a background in IT that knows the ins and outs of the system. And let's talk about user resistance. Not only by possibly the physicians who are used to the paper charts, but possibly anybody else that has been there a while, maybe HIT, MAs, nurses. They're not used to the computer aspect, and they want to just stick with the good old paper charts. So let's talk about evolution. Clinical Data Repository. What this is, it allows for the collection of all clinical data into one centralized database. So again, this could be vitals, a consult, history and physical, an operative report. It's all together. It easy access to data in electronic or printed form to the patient's clinical history. And let's talk about evolution. So in 2004, President Bush supported the use of electronic health records to improve care and reduce medical mistakes and costs. Then we get into 2009. Congress enacted the American Recovery Reinvestment Act, which this included an estimated net investment of $19 billion for health technology. So with this act, what they wanted here is for all healthcare facilities, they gave them so much money to implement the electronic medical record system. But what ended up happening here is you had up these little startup IT electronic health record areas. They'll be like, sell or buy our product for X amount of money. We have a good product, blah, blah, blah. Well, once they got this product, set it up for, the money that the government gave them, there was no IT support because they were little shops that opened up and then they closed down as quickly as they opened up. So then we have the Health Level 7, which was a standards development organization that develops EHR standards under the direction of the U.S. Department of Health and Human Services. And these outline the process how health information needs to be exchanged. So this could be from a physician to a hospital to a research. So again, how are we exchanging healthcare information? 2002 to 2009, the National Alliance for Health Information Technology promoted health IT initiatives. Okay, and let's talk about HIE, Health Information Exchange. This was one of the initiative, which is the transmission of health information between healthcare professionals and patients. Everybody, I'm sure, is aware of how you can get on there and look at My Chart. Sometimes it's called different things. So you can go on there and look to see what happened at your daily visit. Then you can look at to see when's the last time that you had an immunization for, let's say, a tetanus shot. Okay, so that's health information exchange between the professional and the patient. So the transition electronic records, you had to scan the documents, and a lot of it is still hybrid. It's part paper and part electronic. So then we get into the RHIO. It's an electronic network of patient medical information gathered from multiple healthcare organizations in a geographic region. And the goal is to allow healthcare providers the opportunity to access patient information that was generated at other facilities, which allows for health information exchange. So this is a great network. So again, we went in the geographic region. So in my region, I live in Dubuque. Okay, so we right now, Mercy Hospital, or Mercy One, has an agreement with Medical Associates that they are able to share patient information. Stakeholders, we have our hospitals. It reduces administrative cost, improve patient care. Physicians, they have that rapid access to say, hey, I have this patient coming into the clinic. I want to see what happened at their hospital stay. And patients have comprehensive documentation of medical information. Your health plans insurers, they can get records easily to say, oh, this was coded right. They did do it correctly, or no, this wasn't. And then you have the public and governmental health agencies. American Reinvestment Act. With this act is meaningful use. Again, let's look at the standards on page 122. Areas that the act will impact are adoption of EHRs, advancement of HIE, new privacy regulations for HIPAA, and the HIM workforce opportunities. So what are the components of an actual health records? Okay, we have characters, fields, records, files, data, and information. And here's just a patient registration screen. I'm sure everybody has saw this on EHR Go. You have administrative and clinical applications, which is registration, admission, discharge, transfer system. We have a centralized database, which has the patient demographic information and has replaced the paper master patient index in the virtual world. Okay, so these here are just different screens. So different clinical applications. These are patient monitoring systems, pharmacy, lab, radiology, nursing. Clinical applications, medical documentation, patient access, patient portal. Okay, with this, it's a special application that provides patients with secure access to their EHR. They can view their records. I kind of talked about this before, kind of with the health information exchange, how much they possibly owe on a medical bill. They can schedule appointments, and anymore, they can schedule or communicate with providers through an email. With Wellmark Blue Shield right now, if somebody, they can do kind of a virtual office appointment. So, just kind of question out there, how many of you do use a patient portal? Again, there's many challenges transitioning to electronic records. It's a long process, but I think as we look back on it now, pretty much every site is majority of is electronic. There is some paper records out there, but I feel it's getting better. Any questions? Send me an email.